So hello everyone, in this video we will shortly discuss about the 65 trial which talks about the MAP target in older adults with septic shock, which was published in 2023. So the clinical question of this trial was, in older adult patient more than 65 year with septic shock, does a resuscitation strategy targeting a lower MAP of 60 to 65 mm of Hg compared to the usual care affect 90-day mortality? So coming to the background and rationale of the study. Currently, international guidelines recommend maintaining a MAP more than 65 mm of Hg in patient with septic shock. More than 65 mm of Hg in septic shock. However, it is important to note that this recommendation is based on limited high quality evidences. So a trial was published in 2014 named as sepsis spam trial, which compared the higher MAP targeting 80 to 85 mm of Hg in standard with the standard target and found no overall mortality benefit. There was no benefit of higher MAP 80 to 85 mm of Hg in general population, but suggested a potential harm in chronic hypertensive patient. So this raised a concern, especially in older adults, are particularly vulnerable, and the lower MAP can organ hypoperfusion and injury. Similarly, on the other hand, a higher vasopressor dose can cause arrhythmia and ischemia and other complication. So older adults are susceptible to both hypotension induced organ injury and the adverse effect of the high vasopressor dose. Therefore, there was a clear knowledge gap. Could a more permissive MAP target 60 to 65 be safe and potentially even beneficial, particularly in older adults with vasodilatory shock? Based on this, the author proposed a hypothesis that the MAP of 60 to 65 mm of Hg would be non-inferior to the usual care in terms of 90-day mortality. Now coming to the study design, it was multicentric open-label randomized control trial. It was conducted in 65 ICUs in United Kingdom from a period of 2017 to July 2017 to March 2020. So it included adult patient age more than 65 years admitted to ICU with vasodilatory shock who were receiving vasopressor. So they excluded patient with traumatic brain injury, spinal cord injury and the active bleeding patient. They excluded these patients. So intervention was the permissive hypotension strategy. This was the intervention arm where the vasopressor were titrated to target MAP of 60 to 65 and the control was the usual care group. What was the objective? Primary objective was the all cause 90-day mortality, all cause mortality at 90 days, and the secondary objective was duration of the vasopressor support, incidence of the renal replacement therapy, and the length of ICU stay. Coming to the results, the primary objective, there was no significant difference in 90 days mortality between the groups. And in secondary objective, patient with permissive hypotension received a lower average dose of vasopressor, but there was no significant difference in other outcome like renal replacement therapy and other thing. Thank you.